Ladies and gentlemen, good afternoon. Let me present our first module, which is a bed weight testing in the evaluation of urinary incontinence. Urodynamic Committee created working groups for creating these modules. And our working group consists of Professor Krhut, who is the head of the Urological Department, University Hospital Ostrava, Czech Republic, Professor Martan, who is head of the Gynecology and Obstetric Department in Prague University Hospital, Peter Rossier, everybody knows him, the chair of our committee, Peter Smith from Farmington, United States, Professor Volansky from the University Hospital Košice in Slovakia. Me, I'm head of one urological department in Prague, and Peter Zvara from Burlington University Hospital of Vermont in the USA. Actually, our strategy in creating these modules was to make many small size or normal size modules than just a few extensive modules. So this is not an extensive amount of data. This is only just restricted number of slides. What our group made was a search of the scientific database of the bed weight testing. We analyzed it. We pick up important and evidence-based data information and put it together into this module. So the important informations are just the aim of the bed weight testing is either qualitative assessment or quantitative assessment. Just qualitative assessment distinguish between continent and incontinent patients, and quantitative assessment tells us how much incontinent the patient is. The principle of bed weight testing is clear. We compare the weight of the beds before and after the test, and we count the weight gain in grams, which equals urine loss in milliliters. That's clear. And we have two types of bed weight tests according to the duration of the test. We have short-term tests. They usually apply just 20 minutes to 2 hours, and long-term tests and they take 12 hours to 3 days. And the short-term tests, they are used for qualitative assessment, which means if the patient is continent or not. And the long-term test we use for quantitative assessment, so how much urine the patient lost. And this is the only standardized bed weight test that was found. This standardized means it's been approved and recommended by some scientific organization. And this is the only one that's been standardized. It's been 21 years ago, and it's been by the organization organizing this conference. So it's the only one, International Continence Society. And it is the 1-hour bed weight test, which tells us that during the first 15 minutes, the patient is resting and drinking a half of a liter of sodium-free liquid. And in the next 30 minutes, patient is walking, and that includes at least one climbing, one flight of stairs up and down. And in the last 15 minutes, the patient has to stand up from sitting 10 times, coughing vigorously 10 times, running in place for a minute, picking a small object, just like a coin, from the floor 5 times, and washing hand in the running water for 1 minute. How do we prepare patients for the test? For the short-term test, we can make it without preparation, so without retrograde filling, or we can fill the bladder with either 200 to 300 mils, or if we, of course, we know the capacity of the bladder, that's the 50 to 75% of the bladder capacity. And in the long-term test, we don't use retrograde filling. As it's been mentioned, just in short-term test, we can use standardized activities in this standardized ICS test. And in the long-term test, the patient is recommended to perform his normal daily activity. And we use the same technique for the bedweight test in males and in females. What are the cutoff values? Which means when is the test positive? In short-term tests, it is 1 gram, which is 1 milliliter in weight gain, and in the long-term test, it is more than 4 grams in 24 hours. This is the quantification of incontinence. It is the mostly used quantification. It's been published by O'Sullivan in 2004, and you can see it. And when we use the 1 hour test, so mild incontinence is less than 10 milliliters, moderate 11 to 50, and severe more than 50 milliliters. And in 24-hour tests, the mild incontinence is up to 20 milliliters, moderate 21 to 74, and severe incontinence more than 75 mils. It is, of course, the question, when is the leakage significant? Here you have a picture of 1 milliliter of fluid in a spoon, which is 25 drops. And here you can see how it looks like. It's 1 milliliter when it leaks suddenly on the bed and on pants. So I think there's no question that's significant, that's enough significant. And if you make the same test with 5 milliliters, it looks like this. So the leakage is really huge, and it's definitely significant for the patients. That's it. I think it's a strong argument against some statements of some, especially insurance companies, and but also some doctors, onco-urologists, that is incontinence might not be significant. What we know from the evidence-based data? What is the sensitivity and specificity of bedweight tests? In short-term tests, the sensitivity has a wide range of 34 to 83%. So it's quite a huge range, and the sensitivity is not always very high, which means that not all incontinent patients have a positive 1 hour PET test. And the specificity is much higher. In long-term tests, we have no sufficient data for sensitivity and specificity, but it looks like the sensitivity of the test is much higher. Of course, we have limitations of bedweight tests. As I have mentioned, we have a lack of standardization. Just we have only one PET test standardized. All the other tests are our own, more or less our own creativity. So results of the long-term test may be influenced by many things, just like fluid intake, increased voiding frequency, sweating, vaginal discharge can be up to 7 grams in 24 hours, and patient compliance. And of course, just PET weight test tells us nothing about the etiology of incontinence. What is also very important is that the correlation between the degree of patient's bladder and the degree of incontinence is weak. So, what are the clinical conclusions? So, PET tests can surely provide us with additional information about the degree of incontinence and presence of incontinence. It is definitely easy to perform, it is cheap, and it has no complication and side effects. And it could be influenced by many factors, and therefore outcomes should be interpreted in the context of other diagnostic instruments. And what should we recommend for the clinical use of the PET weight test? It is that detailed instruction and patient motivation are extremely important. When we use short-term tests, we use them for qualitative evaluation of incontinence, and we can use retrograde filling, and the bladder should be filled with 50 to 75% of bladder capacity. If we use the long-term test, we should use them for a quantitative evaluation of incontinence, and we always should interpret the results in conjunction with other relevant assessment, just like history taking, questionnaires, self-assessment, physical examination, etc. And the results of PET weight test don't always correlate with patient's level of bladder. So we have patients with a small degree of continence that bother a lot, and we have patients with quite a big leakage that doesn't bother very much. Thank you for your attention.